Hello, everybody, and welcome to The Better Life with Dr. Pinkston. I am Dr. Mariane Pinkston here in San Antonio. And as always, midway through the month, I have my sponsor and good friend, Ray Solano, on the show to talk about some wonderful, interesting new invention he's come up with. So, Ray, good morning. Welcome back. It's nice to have you.
Good morning. Good to see you.
Good to see you as well. So I know we've had a lot going on lately in the men's and women's. Actually, we were going to talk about men's sexual health today, but I know some of this can include women as well. But you guys have had some new creations lately. What are we doing?
You know, that's what we do best. You know, we're able to take a combination of medications that are commonly used in the marketplace and be able to do what we call off-label usage that physicians like yourself are commonly, have to be trained in how to use them. And we put them together as novel compounds that have effectiveness, that personalize medications for people for different conditions. It just seems to be something new and innovative, but pharmacists have been doing this for thousands, I guess hundreds of years. And so it's almost a flashback to what others have been doing, working in partnerships with physicians to help patients.
Absolutely.
And so we put together some unique compounds together with a very different delivery method that makes it easy for people to use. And that's what we do best. So we came up with there was always this need in the marketplace for men's and women's sexual health. And there's so much to the point that the first drug ever was approved for Avexia for women's sexual health, called Avexia. We call it as a peptide. Right. PT141 is the common name, but Avexia was the brand name. And we're able to take that and be able to bond it together with two other drugs that we have found to be very helpful for men and also for women. And we came up with a product, and we give it a nice name so people can remember it, calling it Pocket Rockets.
Which cracks me up every time I talk to one of the patients on appointments. It's like, really? But it's great name.
The naming of something is so important because if you get too complicated, people will forget.
Make it memorable. If you're going to do it, make it memorable. But these three medications are fantastic because not only, have you and I been working with men on erectile dysfunction, but now we have something to offer women for their libido and their sexual function as well. And it plays a dual role. So it's interesting. How do the medications break down and what do they do for people?
Well, it is dual role. This really works on the brain, whereas everything else works in vasodilation into genital areas. So fortunately, the brain is in control so much for sexual health for men and women.
Libido, sex.
So the libido is so critical, and so this works centrally on the brain function, and so it increases desire and increasing bonding and being able to have those other factors involved, and so we have a combination of three items. As one peptide, as we call PT141, is Avexia. It's commonly used as a FDA drug, but we put it in small concentrations in a special way of getting absorbed. It doesn't cause the nausea. The pre-manufactured drug, injectable, causes nausea, right, believe it or not. So what a buzzkill for a relationship.
Right.
So we also added oxytocin. Mm-hmm. Oxytocin or Pitocin is another commonly used drug that's been around for a long time, but it also has an effect here for bonding, and we use it for, believe it or not, for children and for anxiety disorders, and also many of the people that just social bonding. but it also has an effect when it's coupled with this drug, oxytocin. And then we also put tadalafil, another drug, Cialis, which is very commonly used, and it works as a extra delivery method for the other drugs.
Right.
So you put all of them together and you go, wow, this is, why didn't anybody else think about it?
Right.
Well, it's not easy to do with the right combinations, but sure. We feel we got a great dosage form for people, and it's something they can take on a daily basis. And after a while, they get to a level they can probably a couple times a week,
right.
That they can just keep as the maintenance level.
Right.
In addition to the other things that you prescribe.
Sure, absolutely. So I love hormone replacement. The natural bioidentical hormone replacement for men and women, is great for sex drive and for energy and things like that. But when you get down to the erectile dysfunction, a little bit different group of drugs to mix. Like you say, it's a better delivery system, and it delivers, blood to the genital area for men and women, which improves, stimulation and interest. And then I talked with a couple of guys too, when I've been prescribing the Trimix gel that you guys have,
right.
a whole nother show. But I've been talking with these gentlemen. Some of them have performance anxiety. And men don't seem to have as much trouble with libido as women do. Women, have a very difficult time with libido, and this medication helps with that a lot. It also helps them reach orgasm better. But with the men, there's some anxiety, performance anxiety with their erectile dysfunction, and sometimes that can downgrade their libido a little bit. But I feel like this, for men, it's like, well, I have libido, but when you have that performance anxiety underneath, sometimes that boost, the oxytocin and PT 141 can kind of boost their confidence in themselves and their desire. So I think that it helps in many different ways, not only just erectile function. Do you agree with that?
There is an oral product that needs to go along with the injectables of the Trimix, and this is what satisfies that. Right. And that's what there's a good amount of data showing even tadalafil, that anything that increases nitric oxide production in the body is so important for maintaining good blood pressure levels.
Right.
It is one of those enzymatic nitric oxide levels involved in hundreds of different reactions in the body. So having therapeutic levels or normal levels of nitric oxide is so critical to so many other functions. So you start adding all these things together and you go, this is something that the body needs to be able to be on a healthy function. Absolutely. And that's the important thing, is the body's health is so important for libido and also for sexual function.
Sure.
So they all tied together. That's why it's so complicated.
Absolutely. That is why it's so complicated. But sexual health is also good for your mental and emotional and physical health too. So I know a lot of people tend to, as they get older, kind of release that desire, well, I'm getting older. Well, it's not as important. No, it really is. And that is a part of, bonding as a couple and, continuing your health and life, even a little bit of exercise, for lack of a better a bit of walking, maybe more interesting than walking or running or something like that.
That's right.
But you mentioned the nitric oxide. So yeah, nitric oxide helps lower your heart attack and stroke risk. It lowers maybe dementia and Alzheimer's risk. And so when you are using these meds just, for sexual function, you're saying if you use it on a more regular basis, you might even affect your health long-term from heart disease or dementia or things like that?
Well, we think that there's a lot of evidence to show that post-COVID era and people that have been exposed to COVID injections or COVID infections, that their nitric oxide levels and their cardiovascular health and the heart, the endothelial levels, those important layers of the arteries, have been compromised. Right. So we really have to spend some time improving the health of our arteries now more than ever. Right. Because we've seen that many times these very, very deadly virus has long-lasting effects.
Absolutely.
So this is where the post-COVID phenomena, and many people suffering from long COVID are having so many big dysfunctions. So, the good news is that we figured out some therapies that can fix it,
right?
Which is great, as opposed to just not knowing. So that's what we all do best, is we understand the physiology of the body and understand the mechanism, and then we can go to our toolbox and say, how can we repair it?
Right.
So that's the beauty of specialized, personalized medicine.
Absolutely. And I love the compounding pharmacies because of that. You're able to step out of the box a little bit. Now, when I talk to patients about, these different combinations of medications, they're like, well, is that FDA approved? Is it safe? How do you describe compounding pharmacies and the safety to patients?
Well, it's a great question. We hear it all the time. Mm-hmm. We're probably the most regulated profession that is, I say, on the planet, because we have regulatory restrictions for the states and for federal, and we can only use FDA-approved bulk pharmaceuticals.
Right.
And so that's something we can't use, something that's not approved. We can't use anything that, and also methods that are not approved. So when we put these ingredients together, of course, the final combination is not an approved process. But when you use the bulk pharmaceuticals and combine them together, those pharmaceuticals are approved.
Right.
And that's what the beauty of this is. Off-label usage of drugs has been around forever. And they say over 50% of the drugs that are approved by the FDA are used for something else.
Right.
And that's what... that's what's the beauty of medicine. That's why physicians like yourself have to go through tremendous amount of graduate training and tremendous amount of post education, because this is not something that you've been taught before.
Right.
So doing personalized medicine is harder than most other medicines, because it's much easier to do a cookie cutter program. So, what dosage is it? What's the longevity of it? What's the side effects of it? So there's a lot of complications here.
Absolutely.
So there's tremendous safety involved here, because we work very closely with patients and be able to record any adverse events and things that we take that are safe and easy to use and have very little side effects is what we spend most of our time on.
Absolutely. Bringing back the art of medicine rather than
the art of medicine. I like that.
Right? Which is becoming a lost art now, and very sad. But what other things do you have for erectile dysfunction and for sexual health, both men and women?
Well, we also come up with a very unique, there's a product for men called Trimix that if people in this sector, they are very commonly see a injectable form of three chemicals, alprostadil, papaverine, phentolamine. And this Trimix is usually an injectable. And in an injectable, you say, wow, that's pretty, this seems pretty painful. Yeah. But believe it or not, this is the effort that people go to be able to get satisfaction. Mm-hmm. It works very well in injectable form. We've done it for many, many years. But be able to take that dosage form into a special process with a special machine, we can make it into a powder form,
right?
And it's delivered intraurethral, right? So and no needles,
right?
And the website trimixgel.com can go into a lot more detail, but this is no needle solution for Trimix, so you get instant erectile function. This is just a lifesaver.
It is really.
For post prostate patients,
yes.
People that have had chemotherapy, for people that have had surgical interventions. So this is where all the other things just don't seem to work. And the factor that needles cause scarring. Mm-hmm. And there's a lot of side effects long-term for needles. So this is something that just is really a one-time solution. And patients find tremendous success. So practitioners like yourself that are trained and being able to understand the benefits is something that it's life altering for many people.
It really is. And we've had a lot of success in prescribing it. And you and I have worked together in the pharmacy and we have worked together to prescribe this to gentlemen. We've been doing it for almost 2 years now. Can you believe that?
That's right.
And it's been very successful. So tell us where they can go to look it up and get a prescription.
It's very, very simple. We have a nice questionnaire online, trimixgel.com. They can go to our website, pdlabsrx.com. But trimixgel.com has a nice questionnaire they can fill out. And then we will contact you to see if you're a candidate and then make an appointment with yourself. It's a very simple process with a couple steps just to make sure that we're not wasting anyone's time.
Right.
Because this is, it's an investment. It's not an easy product to make, and it takes a lot of time on yourself to be able to make sure that the person's the right candidate and the right dosage too. Right. So trimixgel.com is a perfect way to start. And also they can call us and we can be able to walk them through the process as well.
Yep, absolutely. And you guys are so great. You always talk to the people that call in. It's not just rerouting with extensions and recordings. Somebody usually answers the phone there, and it's wonderful. Even people can talk to you, which is unheard of. Get the boss.
Well, it's, you practice when you're invested in the business, you have to work in the business.
Sure.
We don't really believe in being absentee.
Absolutely. The corporate frame of mind, try to avoid. I do the same and have for 23 years. So excellent. Well, we are going to take a very short break. I do want to remind everybody that you can go to drpbetterlife.com and find the podcast. We've had almost 100 now podcasts that are recorded. You can go all the way back through. You've got YouTube, Spotify, iTunes, all the platforms, as well as here on San Antonio Radio at 930 The Answer. And Ray and I will be back in just a few minutes to talk more about men, women, sexual health.
Hi, this is Ray Solano with your Healthy Choices Minute, sponsored by Prescription Dispensing Labs. New research has concluded that implementing dietary changes could prevent gut inflammatory processes involved in some chronic diseases. Modulation of your gut microbes through diets enriched with vegetables, legumes, grains, nuts, and a higher intake of plant over animal foods has a potential to prevent intestinal inflammatory conditions at the core of many chronic diseases. In short, the foods we eat in our dietary patterns have a major influence on our immune system that can cause many conditions we are suffering from today. Solution: try our OptiMeal shake. Our team has developed the best tasting, healthiest shake you've ever experienced to control blood sugar and to improve your gut. Start your day today with a healthy choice. Call us today at 888-909-0110 for a free sample of the OptiMeal shake. 888-909-0110. Remember, you have a choice in healthcare.
Welcome back, everybody. I'm Dr. Mariane Pinkston here with The Better Life with Dr. Pinkston and talking with Ray Solano, one of my favorite people, a compounding pharmacist up in Cedar Park, Texas. He and I work very closely together and have for a couple of years here. He's on every couple of weeks, once a month with me. And today we are talking about sexual health for men and women because it's absolutely so important. It's a topic nobody wants to talk about. So we're going to do it, and which we've been doing. But we're also going to talk a little bit about testosterone. Testosterone is kind of a mystery to people. I think even women are like, well, that's a man's hormone. And no, it's a human hormone, but it is very important. Men have higher levels. Women have a little bit lower levels. Those are levels we need to maintain for heart health, for brain health, bone health, just health in general, but also for maintaining your muscle mass, helping you with weight loss, keeping your brain focused, helping you sleep better. For women, it's great for libido. But Ray, tell us a little bit about how testosterone is super beneficial and what maintaining your hormone levels would do for you.
Well, the important thing is we want to keep to a normal physiological level, what your body is normally used to. And it's important to realize that this is something that has been changing over the past 20 years and has been down the levels of
Absolutely.
What we're seeing. 40-year-olds and 30-year-olds are usually what we used to see in 80-year-olds. So there's it's
getting worse.
Nothing but tragic.
Yeah.
Is we're finding that there's so much of this sea of endocrine disruptors that are just down regulating our sexual hormone levels for men and for women.
Right.
So this is the reason why we're seeing so many different behavior methods, behavior patterns in boys and also girls, is that things are just being, these endocrine disruptors are causing an imbalance. So it's really important to get your levels checked. And especially when you're in your 50s or 60s, we're finding that there's more men have higher levels of estrogens than some of the women, which is bizarre. And then many of the women have more testosterone than the men. So it's just, what is going on here? So this is why somebody like yourself, to be able to stop this madness and to get the normalization, because depression is linked to testosterone. Now, people don't realize that.
PTSD, things like that.
Being able to not have the zest to be able to do uncomfortable things for men to be able to be ambitious and is tied to this. So the desire to accomplish things is all part of it. So this is so important for us. And, unfortunately, you don't have a choice, because so much of our environment is caused down regulation.
Right. So, a lot of the plastics in the environment, the parabens and sulfates and BPAs and things you've heard.
Pesticides, glyphosate, it's just everywhere.
Everywhere.
Yeah.
True.
So it's really important. And you know how many men don't get their estrogen levels checked for their blood test? It's just like, oh, it does. And I had a good physician friend of mine. He's having prostate problems. And I said, did anybody get your estrogen levels? Did you check yours? And he goes, no. And he checked it again. He says, oh my God, it was off the chart.
Exactly.
And I said, do you eat a lot of chicken? He says, yeah, I eat chicken all the time. And, just seeing this simple things that, well, this is what happens is that when nobody checks it, and it's so common that you have to have somebody like yourself that goes through the entire suite and said, this is the patterns I've seen.
Yes. And doctors do not check it. When patients come to me and said, oh, and I tell them I want to check their labs, and they're like, oh, my doc already did that. And I'm like, no, your doc didn't. Nothing against your doc, but there's a whole large panel of things that are missed that we need to be checking. You're right. Estrogen levels. I do a lot of estrogen work and estrogen dominance with women. And then now we're seeing, you're right, in men. And it is, based on all these products in our environment that are allowed to, be put into makeup, or even candles, air fresheners, even the hand sanitizers, everything, that is available at home, and definitely can disrupt your hormones. And then we turn it around by, stabilizing, but also using more bioidentical means or natural means of replacing them when they do need to be replaced, which is most of the time. And very effective, very safe, very, very safe. People.
Well, you have the right dosage, and you have the right forms.
Absolutely.
Too much of anything is probably causes all different types of reactions. And so what we have to understand is you have to have the right dose for the right person, and in balance. It's symphony. It's not just one, it's all of them.
Absolutely. So
I still feel that somebody who is, 75, 100 pounds overweight, I don't think it's really the best thing to give them a tremendous amount of testosterone. Injections.
Right. And the injectables I don't do at all. I really don't believe in.
There's so many other things that are occurring because we have, somebody who is 100 pounds overweight is a metabolic imbalance. So you got to fix one thing. You just don't throw gasoline on a smoking fire, So that's what we have to really uncover and play some detective work, and that's what you do great in your practice. And unfortunately, take some time. So invest in your health.
Absolutely. Well said. So how can people find you, Ray, and find out more information on the things that you guys, that we prescribe through you?
We have a great website, pdlabsrx.com. We got a lot of our products that specialty supplements, specialty prescriptions. You'll see some webinars on there and some your podcast, of course. But you can always call us at 512-219-0724. And we've got associates working for us out of Boston, Mass, and also out of El Paso. So we're a nationally licensed pharmacy. We have associates that are be able to answer questions all across the country.
Absolutely, and do it very, very well. And they have so many more things, so definitely get in touch with them. You can find them through my website as well, drpbetterlife.com, as they have sponsored me now for almost 2 years and are highlighted on my new website coming out. So get ready for that.
Get ready. All kinds of changes.
Exactly. I'm very
new
excited.
Facilities coming up.
Absolutely.
And we are just going 100 miles an hour.
We are. But thank everybody. I want to thank everybody for listening in. Thank you, Ray, for being on today. And we'll see you in another couple of weeks. And I hope everybody has a great week out there.